Welcome to the 4 or 5 episode of the Diabetic series. My name is Motama Kurumize. I'm a final year medical student at the Middle State University Zimbabwe, and I help sick people, providing them with information pertaining their particular health conditions so that they live life in their best possible health state, not forgetting to point them to Christ, our great physician, even if they have or are about to lose hope. In this episode, we are going to continue with the lifestyle management. In the last episode, we had described nutrition, exercise, and water. Now we are going to look at the other components of lifestyle that are very important in a diabetic patient. Looking at the word start, S is representing sunshine. Whether you're diabetic or you're not diabetic, it is important that you have time to bask in the sun. Sunshine is very good for us. It's a source of vitamin D and everything. And you also get to refresh your mind as you are doing that, and which also helps with your stress levels, because chronic illness itself, such as diabetes, is a risk factor for depression. The next letter is T. T is representing temperance. It is important that we be temperate in doing everything. Overdoing too much of everything is harmful. So if we are modifying our lifestyle, let us do it in a temperate way. Hypoglycemia is becoming common with diabetics. Sources of hypoglycemia that we have is reduced dietary intake of glucose, and also as a side effect of some medications that other diabetics are taking. So hypoglycemia, how does it come about? I'll give an example of a diabetic who is taking their medication, and then because they are scared of having high blood glucose levels, they then limit their dietary intake of carbohydrates. Some may then cancel carbohydrates, totally get rid of them, and they don't eat carbohydrates, which is not good. So if they are scared to eat and they spend the whole day without eating anything, it means they'll have their body glucose stores are eventually going to deplete. And again, the medication is still working to lower your blood glucose levels, and blood glucose level is being lowered by your medication, and at the same time you are not eating, so it then becomes too low. That's when we find our diabetics becoming dizzy, some fainting, some just feeling I'm not okay, and everything is because they would have failed to be temperate to do the lifestyle management. The next letter is A, which is representing air. Just like everyone, whether you have a condition or you don't have a condition, clean air is very important for everyone. And I also mentioned that the diabetics in the last episodes, a complication that comes with them, that they present with more infections if they do not control their blood sugar levels, because they have a paid immunity. So it can come that they are also at a risk of developing infections of the lung. So it is important that we have to breathe clean air and using proper breathing techniques such that we equip our lungs and not compromise them in any other way, because already the immune system is trying to clear the lung infection. So if it then combines with us having poor techniques of breathing and also not having time to breathe fresh air, the lung will be more irritated, especially for those who smoke and they're diabetic. It's a very bad prognosis thing. So we should have time we should always make sure we are breathing clean air. The next letter that comes is R, which is representing rest. It is good that we rest, and this is non-specific. Whether you're diabetic or you're not diabetic, rest is still important, and we thank God He gave us the Sabbath so that at least perhaps we do not find enough time to rest during the week, but we have a day that has been spared for us. Exodus 20 verse 8, that remember the Sabbath day to keep it holy, and it tells us that we should resign from all our works so that we have sufficient rest. The next letter is T, which is representing trust in God. Belief is a good thing. Having a supernatural belief is a good thing in a prognosis of a patient. We believe in God, and we should keep believing in God that He's going to bless our efforts that we are putting in our lifestyle management, so that they bring out fruit after God has blessed our efforts. So it is true, God can heal us. Even if the diabetes that you are in, the condition of diabetes that you are in, has progressed and you now have lots of complications, we should believe God can still heal us. When Christ was here on earth, he would heal lots of people. In Matthew, we find a number of verses, Christ restoring sight to the blind. Even now, you have diabetic retinopathy and you are having poor vision and you are having problems with your vision in general. Christ can still heal you because he would restore people's vision when you are still here on earth. There are some verses which even mention that, and many were brought to him and they were all healed. I believe amongst those, there were also people who were diabetic. There were also people who had high blood pressures, people who had gangrenous limbs that were about to be cut, people who had kidney diseases. They came to Christ and Christ restored their health state. Let us not forget to look at Christ, our greatest physician, in whatever situation that we are in. And let us not lose hope because he is always there for us. I leave you with a verse from 3 John chapter 1 verse 2, which starts by saying, "Dear friends, I pray that you stay in good health and that all may go well with you." Thank you very much for watching. Stay blessed.